The current state of healthcare in the United States 2025. The United States healthcare system remains one of the most advanced, yet complex and controversial, systems in the world. As of 2025, it continues to evolve in response to economic pressures, demographic changes, technological innovation, and ongoing political debate. While the U.S. leads in medical research and innovation, it also struggles with deep-rooted issues around affordability, access, and equity. 1. Healthcare system overview. The U.S. does not have a universal healthcare system. Instead, it relies on a mix of public and private programs. The major public health programs include Medicare for seniors and some people with disabilities, Medicaid for low-income individuals and families, and the Children's Health Insurance Program (CHIP). These programs cover millions, but are supplemented by private health insurance, which is commonly provided by employers. Despite heavy investment in healthcare, about 18.3% of the U.S. GDP in 2024, the system remains fragmented. Patients navigate a complex web of providers, insurers, and pricing structures that often vary widely, even within the same city or state. 2. Health insurance and coverage. As of 2025, approximately 91% of Americans have some form of health insurance, a slight improvement from a few years ago. This increase is partly due to expanded Medicaid coverage in more states, enhancements to the Affordable Care Act, ACA, and increased subsidies for health plans on ACA marketplaces. However, around 30 million people remain uninsured, and millions more are underinsured, meaning they have insurance but still face high out-of-pocket costs, deductibles, or limited coverage. Many underinsured individuals delay or avoid care due to costs, which can lead to worse health outcomes. The rising popularity of high-deductible health plans has also changed how Americans engage with the healthcare system. While these plans can lower monthly premiums, they often shift more cost burden to patients, leading many to forego care or medication. 3. Affordability and costs. One of the most pressing issues in U.S. healthcare is affordability. The cost of care continues to rise faster than inflation and wages. In 2024, the average annual premium for employer-sponsored family health coverage was over $24,000, with workers contributing nearly $7,500 of that amount. Prescription drug prices remain a significant issue, although some federal policies, like the Inflation Reduction Act of 2022, have aimed to reduce drug costs, for example, allowing Medicare to negotiate prices on select drugs. The effects are only slowly beginning to be felt. Medical debt is still a crisis for many. As of early 2025, over 100 million Americans carry some form of medical debt, which can damage credit scores, lead to bankruptcies, and create long-term financial hardship. 4. Health outcomes and disparities. Despite spending more on healthcare than any other country, the U.S. lags behind other developed nations in key health indicators such as life expectancy, maternal mortality, and chronic disease management. Life expectancy in the U.S. hovers around 77 years, significantly lower than many peer nations. Health disparities remain stark. Communities of color, low-income individuals, and rural populations often face worse health outcomes due to reduced access to care, systemic inequities, and socioeconomic barriers. For instance, maternal mortality rates are 2 to 3 times higher for Black women compared to white women. Rural healthcare is in particular crisis. Many rural hospitals are closing or at risk of closure, and workforce shortages, especially in primary care and mental health, are making it harder for rural residents to get the care they need. 5. Mental health and behavioral care. Mental health is receiving more attention than ever before in the U.S., but access to care remains inconsistent. The COVID-19 pandemic accelerated both the awareness of mental health needs and the adoption of telehealth services, but gaps remain in insurance coverage, provider availability, and public understanding. In 2024, over 20% of U.S. adults reported experiencing mental illness, but less than half received treatment. Suicide rates, substance use disorders, and overdose deaths, especially related to fentanyl and synthetic opioids, continue to pose major public health threats. 6. Technological advances. The U.S. remains at the forefront of healthcare innovation. In recent years, technology has transformed nearly every part of the healthcare experience. Telemedicine, which surged during the pandemic, continues to be widely used, particularly for mental health, routine follow-ups, and chronic disease management. Artificial intelligence (AI) is increasingly being used in diagnostics, radiology, personalized medicine, and administrative processes. AI-driven tools are helping to detect diseases earlier, streamline hospital operations, and even develop new drugs. Wearable health devices and mobile health apps are empowering patients to monitor their own health. From smartwatches tracking heart rates to glucose monitors for diabetes, these tools are becoming essential parts of personal health management. Genomics and personalized medicine are also advancing rapidly. Treatments are being tailored to individuals' genetic profiles, leading to better outcomes in cancer, rare diseases, and certain chronic conditions. 7. Public health and policy. Public health infrastructure in the U.S. has seen increased investment since the COVID-19 pandemic revealed weaknesses in preparedness and response. However, public health agencies still face underfunding and political challenges. Vaccination campaigns for COVID-19, influenza, and RSV continue to be central to public health efforts, although misinformation remains a barrier. Mistrust in health authorities and scientific guidance continues to hinder public health communication and compliance. Climate change is becoming a growing concern for public health, with increasing cases of heat-related illness, respiratory conditions, and vector-borne diseases. Public health officials are starting to incorporate climate resilience into their planning. 8. Workforce challenges. The healthcare workforce is facing unprecedented stress and burnout. Many nurses, physicians, and other healthcare workers left the profession during or after the pandemic, leading to ongoing staffing shortages. Recruiting and retaining skilled healthcare workers, especially in primary care and rural areas, is a growing concern. In response, many hospitals and health systems are investing in mental health support for their staff, improved working conditions, and advanced technologies to reduce administrative burdens. 9. Political landscape and reform efforts. Healthcare remains a deeply political issue in the U.S. While major overhauls like Medicare for All have not been enacted, smaller reforms continue to shape the landscape. These include expansion of Medicaid in additional states, caps on out-of-pocket insulin costs, Medicare drug price negotiations beginning implementation in 2025, incentives for states to increase maternal and behavioral health services. The 2024 election brought renewed debates about healthcare policy, with Democrats pushing for expanded ACA coverage and Republicans advocating for more market-based reforms. The divided government means sweeping change is unlikely, but incremental adjustments are expected. Conclusion: the U.S. healthcare system in 2025 reflects both tremendous progress and persistent challenges. It is home to groundbreaking technology, world-class specialists, and unmatched research institutions. Yet millions of Americans continue to face barriers to care, financial hardship from medical bills, and disparities in outcomes based on race, income, and geography. Moving forward, the nation will need to address both structural reform and cultural change to create a system that is not only technologically advanced, but also affordable, equitable, and accessible to all.